Hi, I'm Bill KEEFER, and I have a very important message for you about cancer. I've just been diagnosed with lymphoma. It's a CLL, and it's a low-grade, slow growth cancer, which I'll be going underneath chemo here next Monday. So I have a bit of information for all of you about my type of lymphoma cancer and how they treat it. Keep on watching.
Today we're going to talk about the use of Rituxan Treanda chemotherapy, which is also known as Rituxumab and Bendamustine. It's used for the treatment of non-Hodgkin's lymphoma, as well as several other blood-related cancers. So cancerous cells are characterized by uncontrolled cell division. Both normal and cancerous cells divide by going through something called the cell cycle. And the cell cycle goes from a resting phase through active growing phases and then to mitosis or cell division. The ability of chemotherapy to kill cancer cells depends on its ability to halt cell division. When the cancer cells are unable to divide, they die. Chemotherapy kills cancer cells more effectively than normal cells since the cancer cells divide faster and don't have time to repair themselves prior to cell division. Let's show a brief video now on the cell cycle. So the scheduling of chemotherapy, therefore, is based on several factors: the type of cancer, the rate at which the cancer divides, and the time at which a given chemotherapy drug is likely to be effective within the cell cycle. And that is why chemotherapy is typically given in cycles. Cycles are simply treatments which are separated by time intervals. During that time interval, the cancer cells die while the normal cells have time to heal. When the healing of the normal cells is not complete, side effects occur. The normal cells most commonly affected by chemotherapy include blood cells, the lining of the stomach and the colon, and hair follicles. This accounts for some of the common side effects of chemotherapy, including low blood counts, mouth sores, nausea, and hair loss. Rituxan or Rituxumab is actually a monoclonal antibody, and it's designed to target or inactivate a specific protein on lymphoma cells, which is called CD20. Rituxan locks onto that target, CD20, and inactivates the protein, thereby promoting death of the lymphoma cell. Rituxan also helps your immune system recognize the cancer cell as foreign and attack it. Here's a brief video showing the CD20 molecule on the surface of the cell, and it's sending its signal to the cell nucleus to divide. Rituxan once again blocks this protein. This schematic shows the CD20 protein on the surface of the lymphoma cell. The CD20 protein is activated and sends a message to the cell nucleus to divide. This is the process that's inhibited by the Rituxan, and this message is therefore not sent. Now let's look at the schedule of Rituxan bendamustine chemotherapy. Both drugs are given by vein, otherwise known as intravenously, every 21 days. The total number of treatments varies based on the extent of disease and the response to treatment. Rituxan is given on the first day of each treatment, and bendamustine is given for 2 days on the first and second day of each treatment. Anti-nausea medications are given by vein prior to your chemotherapy and by mouth as needed thereafter. The Rituxan bendamustine regimen, when the drugs are given together, takes about 6 or 8 hours to administer on the first day, since the Rituxan must be given slowly. When the bendamustine is given alone on the second day, it only takes about 1 to 2 hours to complete in the infusion room. Growth factors such as Neupogen or Neulasta may be necessary under the skin, subcutaneously, to help your white cells or immune system recover with treatment. This is not invariably given. Let's look at the schedule now in a little more detail. Once again, both drugs are given together on day 0, and then the next day bendamustine is given alone. Growth factors such as Neulasta or Neupogen may be given to support your immune system, and this entire cycle is repeated every 21 days. Infusion reactions occur actually during the treatment, and they're relatively common with the first dose of Rituxan, but they decrease in frequency with subsequent treatments. The reaction can include flushing, shortness of breath, palpitations, or lightheadedness. Most reactions are quite mild, but very rarely they can be serious or life-threatening. For this reason, you may be closely watched during the initial portion of your treatment. Infusion reactions are reduced by steroids given to you prior to your treatment by vein, as well as other drugs such as antihistamines, which will be administered. Now let's look at the side effects of treatment, which can occur a few hours to several days after your treatment. Most importantly, remember that each person's reaction to chemotherapy is different. Some people have very few side effects, while others may experience more. The side effects described here won't affect everyone who has Rituxan bendamustine chemotherapy.
Hi, I'm Bill KEEFER, and I've just been diagnosed with lymphoma cancer, and I'm going to start chemo treatments in Providence Hospital or Providence Medical Center in Medford, Oregon. They are great people. I've had biopsies there. I've been in the hospital several times. they implanted a port right here into my chest. So when we do chemotherapy, they don't have to access my veins all the time. They can go into the port. And for me and many other people, once you stick needles and needles into it, then the veins collapse, and you're in deep trouble. So I'm Bill KEEFER. Keep watching about the loving care that people all over the world, but in particular Medford, Oregon, and Providence Medical Center. I love them.